Hello, my name is Rowena and I blog about all things beauty on paradeoflove.com, and you can find me on Instagram at paradeoflove. So today I'm here at Halley Medical Aesthetics because I have been wanting to look for a solution to treat my acne scars as well as large pores. So I'll be doing the Fraxel Laser today to try to address all these concerns and issues, and hopefully they work for me. Thank you!
Hi Rowena.
Hello!
Hi, welcome to Halley Medical Aesthetics, and very nice to have you here today.
Thanks for having me.
Okay, I heard that you have got some concerns.
Yes,
Maybe let me know a little bit more.
Yeah, so for me, I have acne, a long-term issue that I have since I was a teenager, and then that caused me to have a lot of acne scars and also like pores on my skin, which you can see from here. Even with makeup, like the pores are very visible. Yeah, so I think that's something that I want to address. Yeah.
Okay. Well, I don't think that you have really that big pores, and your acne scars, while you have it, is not quite as deep as some other people. But we can help, okay? Alright, so what you're asking for is generally a whole face rejuvenation, but a little bit more specific to your large pores and your acne scars. There are many ways of rejuvenating the face. Different ways include injection-based techniques, lasers, or other machines. So, but for you, I would say maybe a laser would be best.
Okay.
Yeah. Most of the time when we do a general rejuvenation, we are looking for a laser which does either peeling from the outside. Okay. So example would be a CO2 laser, or lasers which peel from the inside. And in this case, is Fraxel. Okay. So Fraxel is what we would recommend you for today. Fraxel is an awesome machine. The latest version of the machine is called Fraxel Dual. It's a 2-in-1 treatment. So it's got a deeper layer, which is good for acne scars and pores, which is exactly what they're concerned about.
Okay.
And the more superficial layer is actually good for pigmentation. So for some people who are suitable, we actually use that for melasma, for sunspots, even some pre-cancerous lesions.
They can be used.
Yeah, more common in Caucasians. This can be used to exact them away. So it's a really good all-purpose kind of laser with specific indications like pigmentation for melasma, acne scars that it does particularly well. So for most people, what we do is we do actually 2 layers. Okay. And we can tune it, maybe the power a little bit higher for the concern. So for you, since it's acne scarring and large pores, we will use the 1550.
Okay.
Okay.
So what's the 1550?
What is 1550, which is what you're asking, right? So different lasers have different wavelengths, and that's what gives them the unique characteristics. Okay, so in this Fraxel Duo, that's 1550 and 1927. It just means the wavelength is 1,550 nanometers.
So it penetrates that deep into the skin?
It penetrates a little bit deeper, but there are other lasers which penetrate deeper, but it's unique to this laser that's 1550. Yeah. So different lasers have different wavelengths, and that's what gives us the characteristics. And these wavelengths are made when a very strong laser light is passed through a certain compound to form this 1550 wavelength. So you got this compound, and the strong light goes through, you got 1550, and that's good, as we said, for acne scars, large pores. And then there's also a different compound in which if you were to shine a very strong laser light, which is the 1927, then you get the 1927 laser. And that is specifically better for pigmentation and melasma. And melasma is really difficult to treat, so we do use this machine pretty often for pigmentation as well. So you're right, the 1927, having a slightly wider wavelength, is a bit more superficial. So it's like 2-in-1, right? One a little bit deeper, one a little bit more superficial. So because these 2 lasers do not breach the skin. So let's say other lasers, in order for it to work, we need to go through the skin and go below. So you have a scab that forms from the wound that is formed. This laser has got treatment underneath that skin, but it doesn't breach the top of the skin. So the skin is still waterproof, and you can put on makeup and You can, although you'll be a little bit red, a little bit tan after the treatment within 3 days, if you put on some makeup, you can actually meet your friends, and so the downtime is a little bit less. It's a bit easier to care for as compared to a CO2 laser, but it's really good as well. And uniquely in Singaporeans, whereby we're a little bit more tan than say Caucasians, sometimes this laser maybe would be a little bit less hot than a traditional CO2 laser, and heat is something that's not desirable. And if it's a little bit less hot, then the chance of any side effects is probably a bit lower as well. So this is a really good laser, and I'm thinking of using it for you today.
Okay.
What do you think?
Sounds good.
Do you have
No
any
downtime. I'm very happy with the no downtime.
There will be a little downtime.
I've just finished the Fraxel laser treatment, and overall I feel that it's a pretty comfortable treatment. The pain level is actually quite minimal, especially with the numbing cream. I feel that my skin isn't as red as I thought it would be, and I can actually just put on makeup and go out and do my usual. So I'll be doing a second treatment, and I'm very grateful for Dr. Terence Tan for having me today.